One of the most common questions about Botox is how old do you need to be? The usual age is 18, although studies are typically from ages 25 years and older. I personally have treated my daughter at a younger age just because she had hyperhidrosis, which is her underarms were really sweaty, so I actually injected Botox there for her to help with that sweating, especially since she was in sports. But typically you have to be 18 to get Botox, or you need a parent's consent. And there really are no studies on people getting Botox younger than 25. So to answer your question, 18, otherwise you need a parent's consent. But typically most people are starting at ages 25, 26. Some people are even waiting until they're like 35. But the key with Botox now is that you use it more as like an anti-aging. So instead of waiting until you have the deep lines, they're at rest, we want you to start sooner so that we can relax those lines so that they stay soft. The sooner you get Botox, the better you'll age because your lines will never fully develop. So the angry lines that you have between your brows, if they're there at rest, they're going to be harder to treat. So you're probably going to have to do Botox 4 times the first year, so every 3 months, to keep those lines relaxed, to make those lines soften. What happens when you have those lines is that we're constantly beating up those that muscle. So that muscle keeps going, and then the tissue actually gets beat up, creates that line, and so then we need to kind of re-heal it. So when you put the Botox in there, you actually stop it. So you're stopping that motion, so you're stopping the beating up of the lines, which makes it softer and softer and softer. You have to be very cautious when you're injecting filler in the frown area. So it's typically something that I don't recommend. However, it can happen. But a lot of times people are doing complementary treatment. So they're doing Botox, and then they're also doing some kind of a laser or microneedling or something else to hit from a surface level, and then the Botox actually works at the muscle level, relaxing it to make it softer, giving it a break, and then the lasers or the microneedling are coming back on the surface and regenerating the tissue from the top. So you are basically working on both. You're working from the inside and the outside to get those lines to soften, and you'll get a better result. But the best thing to do with Botox is to not wait till those lines are super, super deep, but to start to treat them preventatively. You'll need a little bit less Botox and you'll never develop the lines, which is super awesome.